Planning pregnancy with hypothyroidism. In this particular episode, we're going to discuss about planning pregnancy and the necessity to plan pregnancy carefully in a person with hypothyroidism. All pregnancies ought to be planned carefully and meticulously to have good outcomes. That applies more so if an individual has a disease like hypothyroidism. If an individual becomes hypothyroid and if they are planning pregnancy, it is very important for that woman to make sure that she gets her thyroid blood test checked shortly before she plans the pregnancy and ensures that her thyroid blood test levels are in the range that are advised by the guidelines. For instance, most of the guidelines advise and advocate that TSH value should be less than 3 in order to plan pregnancy. If the TSH value is more than what it ought to be before an individual plans pregnancy, then there is an increased risk of maternal and fetal complications in such pregnancies wherein the thyroid blood tests are not normal. In order to prevent such complications, one can simply adjust the thyroid hormone doses that they are taking before planning the pregnancy and ensuring that the pregnancy happens only after the thyroid hormone levels in the blood are in the optimal range. So it is as simple as that. And once a hypothyroid lady becomes pregnant, it is very important to consult her endocrinologist immediately as soon as she becomes pregnant so that her thyroid hormone doses could be increased appropriately and her thyroid blood tests are checked as well. This is of importance because during the first 16 to 18 weeks of pregnancy, the fetus does not manufacture its own thyroid hormone and is dependent on the mom's thyroid hormone for normal development of brain. Hence the reason why we need to ensure that the thyroid hormone levels in the mom's blood are in the perfectly normal range, and hence the reason why we need to increase the doses of the thyroid hormone tablets that the mother is taking as soon as she becomes pregnant in order to ensure that the thyroid hormone blood test levels are in the normal range for that particular trimester. Moreover, it is important to ensure that the thyroid hormone blood tests are checked periodically, say every 4 to 6 weeks during pregnancy in order to ensure that the thyroid hormone levels remain in the normal range. Most of the women after pregnancy, they end up needing lesser doses of thyroid hormone than during pregnancy, and again this could be advised by their endocrinologist. Various maternal and fetal complications such as myopathy, that means body aches and pains, heart related problems such as congestive heart failure, at the same time other complications of pregnancy such as preeclampsia, placental related problems and neurological problems in the fetus could be easily averted if the thyroid hormone levels are checked appropriately, if the pregnancy is planned appropriately and monitored appropriately during pregnancy, if a person with hypothyroidism were to plan pregnancy. So on this note, I urge everyone to ensure that their thyroid hormone levels are in the advised normal range before they plan pregnancy, and also maintain appropriate follow-ups with their endocrinologist during pregnancy and after pregnancy to have a healthy baby and healthy outcomes from their pregnancies. Thank you very much.